Welcome back to Medical Monday. Tonight I'm Carrie Sharp, joined by Dr. Lucy Ledbetter, a neurologist in Columbia, talking to us tonight about Alzheimer's awareness and also prevention. We're having a very interesting conversation in the break about medicine that anybody could be taking that could be having an impact for the long term.
That's correct. There are several medications that have been found in patients who are normal 70-year-olds that are associated with a higher risk of dementia later on. These are medicines in the anticholinergic family, which means in general, any medicine that can cause your mouth to be dry can increase the risk of dementia and also can affect memory in these people while they're taking the medication. These are medicines such as Benadryl, medicines for allergies, medicines for indigestion, any of the medicines that end where the generic ends in the letter Z-O-L-E, like omeprazole. Those medicines are associated with a 50% increased risk of dementia. Also, antidepressants can increase the risk of dementia. Sleep medications such as Ambien or Lunesta can do it, and also medicines that lower anxiety such as medicines in the Valium family, Xanax, Ativan. All of those were shown in a study to increase the risk by 50% of developing Alzheimer's disease over the next 7 years.
And you're talking about a study that looked at the older generation.
That's correct.
But the big question mark is, these are some of the most prescribed medicines that we have out there right now, and people of all ages are taking them. So
That's
someone
correct.
taking them in their 30s, 40s, and 50s, what's happening to the brain?
Well, we don't know what's happening to the brain. The way these medicines work is they lower the level of acetylcholine. That's the neurotransmitter that is responsible for memory. When we are treating patients with Alzheimer's disease, we give them medicines to increase acetylcholine. So by taking these medicines, you're lowering the same chemicals that we want to increase. What is it doing to a 30-year-old? I don't know. Nobody knows. The research hasn't been done. However, if you don't need these medicines, don't take them, because we just don't know what they might do down the road.
So very important. We're often worried about the side effects that will affect us right now. You know, don't drive. This may cause sleepiness, but what about those side effects that are going to happen decades down the road? We just don't know. That's
right, Carrie, but I do want to say one thing. Talk to your doctor. Don't just stop your antidepressant or don't just stop these medicines, because the benefits for you may very well outweigh the risks. And we don't know that they're risky for a 30-year-old. We do know without a doubt they're risky for a 70-year-old. But if they're not absolutely necessary, talk to your doctor about maybe getting off of some of these or going to a different choice that's not in the anticholinergic family.
Fantastic point. Let's go to Stephanie now on the line. Hi, Stephanie. What's your question tonight?
Hi. Thank you for taking my call.
Sure.
I have a question. Is it possible to take the acetylcholine if I'm taking Synthroid for hypothyroidism and ferrous sulfate for anemia? Can I take these things within, a 24-hour period? On a daily basis? Will they interfere with the Synthroid or the iron supplement, the acetylcholine?
Well, the medication isn't acetylcholine itself. It's a medication that results in your brain making more acetylcholine. Now, always when I prescribe a medicine for a patient, I'll run the two together in my computer and be absolutely sure. I don't know of any reason why you couldn't do that, but I would definitely check with your doctor about it. Not everybody needs to be on these medicines, but if you've had trouble with your memory, it is definitely worth talking to your doctor about perhaps taking a medicine that raises acetylcholine in your brain and potentially helps your memory.
Okay, thank you very much.
Stephanie, thank you for calling. I sure hope that helps. Well, we talk about medication. I always like to look at the more natural side of things. Supplement-wise, what can people do, whether it's prevention or when she's been diagnosed? Anything helpful?
Well, Carrie, that's a really good question. There are some medications that have been shown to be protective as far as decreasing inflammation in the brain or just simply supporting your brain. And one of those is a vitamin B complex. Folic acid may be helpful in preventing Alzheimer's disease or slowing progression of memory loss. Vitamin B12 is one of the vitamins that has been identified that can slow progression of dementia or even prevent dementia in some cases. Also, vitamin D has been discussed as far as a vitamin that can help prevent or slow dementia. Magnesium is another one. Now, there's a whole list of vitamins and supplements that haven't really been proven to prevent or improve dementia, but we don't really know of any risk or any reason not to try them. It's just they've never really been thoroughly tested. One of them we talked about earlier is ginkgo biloba. There's not any proof that it works, but I don't know of any reason not to take it. And there are a whole list of things. One thing that has been tested that has not been shown to really help very much is vitamin E. It makes sense that it would because it's an antioxidant, but it really has not panned out as far as a preventative or a substance that can slow the onset or the progression of dementia. Now, one other interesting thing is that there have been studies of anti-inflammatories, in other words, like ibuprofen or Aleve, and it doesn't prevent Alzheimer's disease, it doesn't prevent dementia, but it can slow the progression, presumably because it's an anti-inflammatory and decreases levels of inflammation in the brain.
When you have a family in front of you and you deliver the diagnosis of Alzheimer's, I know there are a lot of practical things that you have to go through and medication and really dealing with that. I recently read Kimberly Williams Paisley's book, Where the Light Gets In, and about her mom's journey with Alzheimer's. Yes. And she said, I wish one of the things that the doctors would have told us from the get-go was have that conversation about what your family member wants to happen when things have progressed and they can't vocalize that. Do you speak with your patients about it?
I do. That's very important because you want your patient to be involved in decision making. You know, what do you want to do once you can't live here by yourself anymore? Or what do you want to do if it comes to a point where your family can't take care of you anymore? I do. And who do you want to be your decision maker? Because who do you trust? Those are important questions, and it's tough to have that conversation. It's tough to say, you know, a year from now you may not be able to make these decisions, and I want to know right now what you want, what your opinions are, what do you want me to do. And it's, you know, there can be a lot of tears, and it's a tough conversation to have, but I don't want to know what your family wants. I want to know what you want. And it's a very important conversation to have, and it's important to make some decisions and maybe establish a conservator or a medical power of attorney while you can still have the ability to make informed decisions.
And it can really, later on, decrease a lot of stress for your caregiver and the family, and perhaps prevent some fights and stress in that way.
That is true. Because there can be a lot of hard feelings, and sometimes it diffuses things by me saying to the family, I don't want to know what you want, I want to know what they want. And they'll say, well, oh, that's easy, I know what they want, you know, and so sometimes that takes the pressure off the families too. Another
hard decision always comes down to driving and whether someone should be driving. How do you handle that?
That is a tough one, because if you wait to a point where someone's gotten lost or someone's had an accident, you've waited too long. Yeah. But typically, my criteria are if someone has developed sundowning, for instance, and that means confusion that tends to occur in the late afternoon, they don't need to be driving. If they have any trouble as far as orientation, getting lost in familiar places, or even just adapting to new situations, I typically say, okay, it's time for you to get a driver, because those are the kinds of things that tend to lead to accidents. So I want to preempt that. I don't want a person to have an accident before we take the keys away. And you have to think about, they could harm themselves, they could also harm somebody else, and nobody wants that to happen. That's right. Yeah. So, and usually, even though it's hard, usually patients understand. All right. On that note, we're going to take a quick break. When we come back, we will wrap things up. If you would like to get a hold of Dr. Ledbetter, we're going to give you all the information on how to do that. So now would be a great time to grab a pen and a paper, and we'll get that information to you when we come back.